I'd like to ask the Minister for Health and Social Care what his strategy for patients having treatment at Clatterbridge Cancer Centre in the future will be.
Minister to reply, Mr Ashford.
Thank you, Mr President. The Department currently has an agreed activity tariff plan with Clatterbridge Cancer Centre for patients who need specialist care off island, as this care is not available on island. We also have a visiting consultant service model which is currently delivered on island by Clatterbridge Cancer Centre. Both service delivery models have a number of limitations and do not support integrated pathways and in-reach services to the island. The Acute Directorate plan to form a partnership arrangement with Clatterbridge Cancer Centre to develop an integrated on- and off-island shared care pathway for cancer patients who require specialist treatment for solid tumours, oncology, or blood malignancy, hemo-oncology. We plan to work with Clatterbridge Cancer Centre to develop a sustainable, agreed new service model for 2020-2021. This will coincide with Clatterbridge Cancer Centre's move to their new premise in the centre of Liverpool, where Isle of Man patients will receive their off-island specialist care.
Supplementary, Ms Hayes.
Thank you, Mr President. I thank the Minister for that. I wonder, is it possible to circulate to members some of the strategy, or whether to involve patients who have perhaps been involved in the treatment? My main concern with regards to the move to the centre of Liverpool for Clatterbridge and some of the treatments for our people from 2020 is being able to get a hotel room, etc. And I wonder whether the Minister is considering a policy with a service provider for bed nights or hotel bed nights, or whether he's considered an actual unit for the Manx patients with regards to this move in 2020.
Mr Ashford.
Thank you, Mr President. In terms of accommodation, it is something we're having discussions with in relation to providers. It's early days yet. As I said, we are trying to develop something with Clatterbridge Cancer Centre. Obviously, in an ideal world, we would have everything done on island. We're not in an ideal world, we never will be. What is important is that treatment, when it is carried out in an appropriate place, and that will always mean that there will be certain elements of treatment off island. As was announced last month, we have increased the accommodation rates for the first time in 15 years. They have gone up. So it does make accommodation much more affordable now than it was previously. In the event that there's special events on, then there is leeway sometimes for patient transfer to consider a higher proportion. What is important is that we speak to Clatterbridge Cancer Centre and ensure that we have a robust pathway in place for people, so that the treatment they are receiving potentially on island and off island are joined up, and that will be the importance of the strategy, and that will involve talking to the consultants concerned both on island and off island, and also of course patients will be brought into the process.
Supplementary, Ms Edge.
Thank you, Mr President. I'd just like to ask the Minister with regards to whether he's going to review the actual payments with regards to, I know he's increased it significantly and it hadn't been increased. However, having been there recently with a number of patients and speaking to them, there is still difficulties for patients because of the cost of accommodation, and I see a big issue coming forward in 2020 when it is in the centre of Liverpool. So I'd like to ask the Minister if he is going to review that policy on an annual basis.
Minister.
Thank you, Mr President. It was in the press release and it was confirmed by myself. It will be reviewed every year as part of the budget process.